Common drugs used for toilet infection in Nigeria. Toilet infection is a misconstrued term for vulvovaginitis which is popular among women. Continue watching for the list of drugs used for toilet infections in Nigeria. It is a term used to explain abnormal vagina discharge, itching, swelling, and burning in a lady. However, this is not entirely true, though it is unsafe and not a good hygiene practice to use dirty toilets. The name toilet infection became popular because infected persons have pains when urinating. Toilet infection can be caused for several reasons. It can be a result of dirty underwears, use of medicated soap or antiseptics to wash the vagina, use of antibiotics, changes in hormones, irritation, and many more. Types of vagina infection. Bacterial vaginosis. This is a vagina infection common in women. Bacterial vaginosis. This is a vagina infection common in women. This happens as a result of the imbalance of the bacteria in the vagina. However, it is not a sexually transmitted disease despite having symptoms similar to one. It is caused by a high proportion of harmful bacteria growing in the vagina. Causes of bacterial vaginosis. This is harmful to the vagina because it gets rid of the good bacteria and exposes the vagina to infection. An infected pregnant person has a high risk of complications with the pregnancy. Also, BV increases the chance of contracting sexually transmitted diseases. It is important to know also that one cannot get infected with BV from toilets. Bacterial vaginosis in males does not require much treatment compared to females. Symptoms of bacterial vaginosis. The symptoms listed below are common to a person having BV, but a medical doctor's diagnosis is a final confirmation as to whether such a person has BV. Yeast infection. Yeast infection is another common vaginal infection among women. According to statistics, 7 women out of 10 women are likely to have a yeast infection. Also, yeast infection is a sexually transmitted disease and is not contagious. However, one can get it through sexual intercourse with the infected person. The vagina environment is made up of bacteria and fungi. Yeast infection occurs when the growth of the fungi, Candida, is not kept in check. The bacteria responsible for creating the balance of the growth of Candida fungus is Lactobacillus. The imbalance's growth of the Candida fungus can be caused by the use of contraceptives may cause changes in the hormones which can trigger exponential growth of the Candida fungus. The use of certain antibiotics may as well get rid of the healthy bacteria and lead to the increase of the Candida fungus. It is also possible to have a yeast infection during pregnancy. Douching can also be a cause yeast infection. Symptoms of yeast infection. The vagina becomes red and swollen. White vaginal discharge which is odorless, unlike the fishy smell in the case of BV infection. Common drugs used for toilet infection in Nigeria. The common drugs used for toilet infection in Nigeria are metronidazole, levofloxacin, clindamycin, fluconazole, boric acid, miconazole, norfloxacin. However, this is just a compilation of drugs used in the treatment of the infection. An infected person will still need to see a medical doctor to help ascertain what kind of infection he or she has and what treatment is required. Metronidazole. Metronidazole is an antibiotic drug used to treat bacterial infections. It helps to get a stop to the imbalanced growth of the bacteria causing harm. Metronidazole is not advisable for pregnant women. Causes of yeast infection. Levofloxacin is also one of the drugs used in the treatment of bacterial infections. In addition, it is used majorly for extreme cases of infections as it is a very powerful drug with serious side effects. Clindamycin. Clindamycin is an antibiotic drug used to treat bacterial infections. It is usually recommended for serious cases of bacterial infections. Diarrhea is the major side effect experienced in the use of this drug. Fluconazole. Fluconazole is a drug used to treat yeast infections. It helps stops the reproduction of the Candida fungus in the body, thereby creating a balance between the bacteria and the fungi organisms in the vagina. Levofloxacin. The side effects of the drug are nausea, vomiting, and headache. Boric acid, Boricap. Boricap can be used in the treatment of recurring yeast infections. Its side effect is redness of the vagina. However, it is not advisable for use by pregnant women. Miconazole comes in two forms, a cream and a tablet. It is used in the treatment of yeast infection. Toilet infection is a common scenario among females. However, good hygiene practices, protective sex, and prescribed drugs can help to manage, control,